Atrial fibrillation is a problem affecting many patients in the UK, a lot of which can be modified by changing their lifestyle. There are a number of factors that can affect the amount of atrial fibrillation that patients get, the symptoms they get, and the management of atrial fibrillation. These include weight, they include exercise, they also include management of diabetes, high blood pressure, and high cholesterol. People with atrial fibrillation need to look particularly at weight loss and exercise. There is very good evidence that if people who are overweight, and we do not mean here necessarily obese, but just significantly overweight, if they lose weight and take regular exercise, they can dramatically reduce the amount of atrial fibrillation they get and improve other factors in terms of their diabetes, high blood pressure, and cholesterol. Looking at the lifestyle changes that patients can utilize to help improve atrial fibrillation, the main factor is weight loss and then exercise. There is very good evidence from studies that if people can lose 10% of their body weight and keep that weight off, that is almost as good as having an ablation for atrial fibrillation and will result in about 70% of people actually getting rid of their atrial fibrillation. Looking at studies that address lifestyle modification, the two main studies are Legacy and CardioFit. These were studies that were undertaken in Australia, and what they did was they introduced a system of outpatient clinics and follow-up of patients who were overweight with atrial fibrillation. And what they demonstrated was that if you take these patients and you get them to lose weight and the weight stays off, and in addition they undertake exercise, that their atrial fibrillation improves dramatically, their diabetes control improves dramatically, their blood pressure control, and their cholesterol, to the extent that some patients can even stop taking medication to control these things. The problem is it is difficult to get people to do this because just seeing a person and saying to them, you need to lose weight, doesn't work. The advantage of the system that was shown in these trials is having a system whereby patients are followed up on a regular basis. They need the contact to see people, to say, to reinforce, are you still losing weight? How are things going? And that's the key. And that is an issue that we are struggling with in the UK because this requires funding to do this. You need to have the system via GPs funded so that we can do this, and that is a big problem. At the moment, there is no service in the UK like this at all. And that is something I'm trying to change, but at the moment it doesn't exist.